Stoll, Councillor Jodie Stoll, the Chairman of the committee, and I would like to welcome you all to this meeting of the Adult Social Care and Health Select Committee that is being broadcast live and recorded for publication. So before we start, I'm just going to tell you a little bit about myself. So as I've already said, I am Councillor Jodie Stoll. I'm the County Councillor for the Calverton Division of Nottinghamshire. This is my first time as a councillor and the first time chairing a committee as a councillor. And I'll be honest, I'm a little bit nervous, but I'm genuinely honoured to take on this role, especially for such an important and meaningful area. Adult social care and health services are about far more than just managing budgets or services. At their heart, they exist to support adults across the county to live independently, safely and with dignity, particularly those who are older, vulnerable or facing complex challenges. Whether it's through home care, residential services, safeguarding, mental health support or public health initiatives, the work that we do has a direct impact on the lives of real people and their families. I've experienced this personally as my own mother lives with Alzheimer's and is a service user. Many of you will have your own stories. How we support people in these circumstances reflects the kind of society we are. When families are supported, communities are stronger, and when communities are stronger, our country is stronger. That's why this committee's work is so important and why I take this responsibility very seriously. This is a scrutiny committee and should be about scrutinising, not political grandstanding. There is more than enough opportunity for political debate in full council meetings, so can we please save that for the council chamber? Here we are focused on evidence, outcomes and holding services to account, which is in the public interest. I hope we can all agree on that principle. With all that said, I'd just like to touch on a few, if you like, a few house rules. So with questions, to keep things structured and fair, please keep questions clear and to the point. This helps officers and guests respond effectively. Please avoid combining multiple questions into one question. One focused question at a time ensures clarity and fairness. And with regards to the questions, I would like to keep to the following if possible. One question, one answer, a follow-up question, if there is one, and of course the follow-up answer. We will then move on to the next member, should there be questions, and then we'll return around, we'll go back around the room for any further questions. I believe this approach ensures fair participation for all, allows for thorough scrutiny, and will keep the meeting running smoothly. Before we get fully started, for the benefit of everyone present and those on the live stream, could we quickly go around the room and have a brief introduction from everybody, if that's okay?
Yep. Right, so I am Councillor Joseph Rich. My division is sort of central and east, and I'm the vice chair for adult social care. Basically, I understand a lot of like yourself, with adults that have won their independence, and I feel that they're paying when they don't get that support that they need. So yeah, I'm going to pass on to the next person.
Thanks. I'm Don Monaghan, Advanced Democratic Services Officer, and I'm clerk for today's meeting. Thank you.
I'm Penny Gowland. I'm the councillor for this area here, West Richmond North, and I'm new to this committee.
Roger Jackson, South Division as County Councillor, ex-chair of this committee.
County Councillor Simon Wright, Kirkby North.
County Councillor Brown, Mansfield West.
County Councillor Anthony Coleman, Walsall.
Keith Girling, Gilt West Division. I was on this committee in 2005 as an opposition council and Labour in control of this council, so I do have some history on adult social care and health, but it is a long time ago. But now I think I qualify for being on it for other reasons, because the age probably, and the uses I make of the NHS and everything like that. So that's my contribution.
Councillor Richard Butler from the Cochrane division of Nottinghamshire. Many, I think probably in 2005, I was the opposition spokesman, I think, on adult social care at the time. But I've not been on the committee for quite a few years. But I agree with your sentiments, Councillor Stoll. What we need to remember is adult social care is pretty much, it is the biggest issue that this authority is responsible for, and it's getting ever more challenging. So we look forward to helping the people.
I'm Councillor Barry Answer, Mansfield West. I'm the Cabinet Member for Adult Social Care, and I'm coming along just to see how your committee works, and looking forward to working with you, throughout our term. Thank you.
Morning, I'm Melanie Williams, Executive Director for Adult Social Care and Health. So as the key officer supporting committee, I suppose my goal is to make sure that you've got the information that you require to, to make really good scrutiny, to challenge cabinet decisions and to think about our performance on an ongoing basis. So the intention this morning really is to have a really good conversation, to leave you with a good understanding of adult social care, how we provide that in the council, and then, like I said, an indication of some of the things that you would like to see on the work programme. So good morning.
Good morning, I'm Katie Ball, I'm Service Director for Strategic Commissioning and Integration. So I'm part of the Senior Leadership Team for Adult Social Care and Health.
And Mark Sally, Senior Scrutiny Officer.
All right, thank you very much, everybody. Look forward to working with you. So thank you for your introductions. Councillor Jackson.
Yeah, Chairman, if I could just make a bit of a comment being the lead spokesperson, because as you said already, this is a very important committee and non-political, and a very important job to do. We were sitting here this morning with absolutely nothing on the agenda. I don't think the portfolio holder here is for this service area. No, yeah. Portfolio. I'm sorry, Barry, I missed it. Yeah, but welcome. I'm pleased that you are. This committee looks at health and welfare of the Nottinghamshire residents and constituents, and more importantly, scrutinises decisions made by the cabinet members and officers. Adult social care has one of the largest budgets of the council and has to make critical decisions regarding people's health and well-being. Being a past chairman of this committee, I know how important it is, and to have a work programme that looks into and scrutinises the areas of health concerns raised by members. Last year, we were looking at early deaths in Nottinghamshire, which is the highest, is a lot higher than the national average, especially in women. Work was being done on post and prenatal care for young mothers and their children. What has happened to these two many important subjects? And that was just two on a long work programme that we had. We won't be having a meeting again until September before we can do any meaningful work, which is 5 months after the election, which, thanks to Chairman, is just not good enough for the people of Nottinghamshire we represent. They expect more work from this council on their behalf.
Okay, is that complete, Councillor Jackson?
Yeah.
Okay, was there a question there as such?
No, it was a statement. I said it was
It's just a statement. Okay. Statement noted. Thank you very much. Okay. We will move to item number 1 on the agenda, and that is to note the appointment at full council on the 22nd of May 2025 of myself, Councillor Jody Stoll, as chairman of this committee, and of Councillor Joseph Rich as vice chairman of the Adult Social Care and Health Select Committee for the 2025-26 municipal year. Okay, we'll move on to.
With complete respect, I just wonder if going forward, not today, it would be possible for the chairs to sit there, just in terms of being able to hear and see. There may be a really good reason, and maybe we all want to be nice and see each other, but just conventionally, it's just very hard to.
It's for the AV equipment, because the microphone is there and the room is mic rather than individual mics. The best place for picking the members up is here. That's why the chair and vice chair have generally been sitting here. We can change it, but it's just how it's broadcast.
There is a conventional way of doing these things. It sounds a bit old-fashioned, but there is a reason.
I have wondered
thank you.
myself if that is something you could make.
Or back in the train.
Well, that would seem sensible, yeah.
Maybe. We can look at that. That's a different question. Okay. Sorry, can I just finish the preamble, or do you?
No, I thought you had. I thought
Yes,
you had said who was in the committee.
I haven't got to that bit yet as to who's in the
Okay.
committee.
Oh,
Yeah.
no, I thought you had, sorry.
No, sorry. So that's item 2 on the agenda. To note the membership of the committee for the 2025-26 municipal year as follows. Councillors Mike Adams, Richard Butler, Terry Cox, Jan Gould, Penny Gowland, Roger Jackson, Andy McCormack, Brian Wheatcroft and Simon Wright. However,
It will probably change.
so who is Mike Adams?
It's changed. That's what I was going to say.
Right, okay.
Yeah.
So you've substituted for Mike Adams?
No, I'm taking over from Mike Adams. It's not a substitute.
Okay,
I'll be permanently on this committee.
okay, that's fine, that's noted.
Thank
So,
you.
yeah. Councillor Keith Gerland has replaced Mike Adams.
Thank you.
No problem, thank you. To note also the revised terms of reference for the Adult Social Care and Health Select Committee that were approved by full council on the 22nd of May 2025. As the report is for noting only, it does not need to be moved, seconded or voted on. Members are however able to ask questions on the report. Okay, item number 3, and I'm going to ask the committee to approve the minutes of the last meeting. However, I'm aware that nobody here would have been on the last meeting, so
We've just been taking them as read.
yeah, we will take them as read. So if we could have a show of hands, would be great. Okay. And item number 4, could I ask the clerk if there's any apologies?
Councillor Terry Cox sends apologies under the category other reasons. Thank you, Chair.
Okay, thank you very much. And declarations of interest. If any councillor or officer has an interest in any matter on the agenda, you should declare it now. Please raise your hand now if you have an interest to declare. If you have an interest to declare, you should state what type of interest it is, and please give brief details. Thank you very much. All right, item number 6, and this is the presentation to advise the meeting that this item is to introduce members to the role of the Adult Social Care and Health Select Committee and to assist members with the development of the committee's work programme for 2025-26. Officers Melanie Williams will make a presentation to the meeting, after which members will have the opportunity to suggest items for inclusion in the work programme going forward.
Thank you.
Okay, thank you, Melanie.
So in sort of prepping for the meeting, I had the conversation with the chair that we would pause after every few slides. So if there are some things that you wanted to ask, maybe indicate to Councillor Stoll, and then we can go through that, but I'll sort of crack on. And what we'll do is we'll talk about the items, we'll talk about the previous work programme, the sorts of things that Select Committee got involved in before, and the sorts of things that we used to do to manage that item, just with the intention of helping you sort of frame the work programme. Excuse me. And then particularly, I think, learning from Councillor Jackson's point about things that we had on the programme and things that we'd recommend taking forward. So that's the intention of the session. So the best place to start really is about our vision for adult social care. So this was a vision that we co-produced, people with lived experience and their carers. That's a really important principle of adult social care, that we do things in partnership. So adult social care, when it works at its best, does things with people, not to people. We have a group called Our Voice in the council that represents people with lived experience and the carers. They co-chair things with me, and I'm really proud that this subcommittee in the past has had people with lived experience and carer representatives presenting items to committee with me. And it's certainly something that I'd recommend as a way of working going forward. I think that's really important. It gets a chance to hear from people directly as well as through other people like myself. Try some water. So this is our vision, really, that we want every person in Nottinghamshire to live in a place that they call home, people that they love, and communities where they can look out for one another and do things that matter to them. And that's really important, actually, that vision is from their own perspective. It's not about what you or me or other people may want for them. It's about what they want for themselves. So that really underpins the way that we work. We don't achieve this for everybody all of the time, but certainly this is what we aspire to. And what I hope Select Committee can join officers in is working out on the way when we don't achieve this for people, what are the steps we need to do to make that a reality for everybody. So the sorts of things that we do to achieve that vision, like I say, is about, first of all, working with others. So co-production is a really important principle. Understanding about how somebody wants to live their life, and mainly it's relevant for somebody with a disability where work is their aspiration to the point where it may be an older person in the last few days of their life. So it doesn't matter where that person's needs are, where they live, what's driving their adult social care need, that they get the opportunity to live their life in the way that they want and they keep well and as safe as possible. It's really important in order to do that, somebody has the information that they need. It's an easy thing to say. It seems quite obvious. Well, let's just give people information. It's something else that's harder to do, to give information in a way that's easy to understand, that's accessible, particularly in the way that a whole range of people access information, have communication needs. But that is still an important aspect of what we do, really good information, advice and guidance. And the way that we work keeps family and social connection together. That's a really important principle as well. And like I say, staying in control. So somebody having as much choice and control as possible, and family informing some of that. When we work with adults, it's really important that it's the person themselves that stays in control. So in order to achieve that, the workforce we aim to have is a workforce that's well equipped to support people, that's well trained, well informed, and that enjoys a good level of well-being. And that would be regardless of whether they're in a workforce we employ or whether the workforce, there's 35,000 people that work for adult social care across the county, most of whom we don't employ. Clearly, I only employ 1,800 people. So really what we want is a strategy that Select Committee and Cabinet agree that supports the whole of that workforce. That's really important. So what is adult social care? So adult social care is a term that's defined in law. So we have the Care Act, which was created in June 2014. And that describes what adult social care is, who it's for, and how local authorities assess for adult social care need. So it talks about having eligible social care need. So I may have social care need, but it may not be eligible. So there's a really important point about what would meet eligibility. There's a national criteria. So before the Care Act, councils could set their own access criteria. That no longer is possible. There's a uniform criteria. So if I live in Nottinghamshire, I'd have the same criteria as if I lived in Leicestershire, Kent, Somerset, wherever. So that's a really important part of the Care Act, is that it requires a certain level of equality. We then, as a council, have the duty to make provisional an arrangement for those needs. So those needs may be met through services, but equally it could be met by information, advice and guidance, or access to something else. So the council doesn't necessarily have to provide all of the services itself, but it needs to be able to arrange them with that person or on behalf of them. A really important principle in the Care Act equally is about preventing and reducing delaying adult social care need. So wherever possible, as a council, we need to work in a way that is enabling that person to live as independently as possible. So for example, if somebody has had 30 years of staying in a high secure hospital and is ready to come home, which is one of the things that we do in adult social care, we would work to make sure that wherever that person moves to is a least restrictive setting. So reducing and delaying need in that person's circumstance is them having as least restriction as possible. For somebody, like I say, an older person who may be in the last few days or weeks of their life, that will be about receiving social care that's in a dignified way, that enables them to try and communicate and to hear their wishes, and that will be about preventing, reducing, delaying need. Or equally, it may be that I have a mental health issue, I'm ready to be, I'm still having some difficulty, need support, but I'm ready to access work again. So that will be about maybe me moving to complete independence where I no longer need adult social care. All of those activities, all of those individuals are entitled to have their needs reduced and prevented and delayed. So like I say, the goal of us is to, the goal of adult social care and as a council more broadly, given our range of duties, is for people in Nottinghamshire to really lead fulfilling lives. So people, like I say, can have a whole range of ways that we work together. Importantly for this committee is recognising when something is a council responsibility and when it's a responsibility of something else. I do have a duty to make sure I work in partnership and collaborate with others and integrate services where where it's relevant, but not to be able to do the duties that maybe would be the NHS or a housing authority or the police if it's an antisocial neighbourhood dispute or a district council. So we've each got our responsibilities and we have to work in a way that's collaborative, but we don't have a duty to meet other people's responsibilities within the Care Act. And that's quite important because there's a limit to the things that county council resources can do. And just a bit of a note that I always talk about, that the NHS is free at the point of treatment and entry. So that's an entitlement that you have under the Health Act, that you don't pay for care, whereas social care is not free. So everybody will make a contribution to their care. So some people that will meet the costs of all of their care, and for some people it will be just a contribution, but it will be to the maximum they can afford. Their means will be tested, if you like. There are lots of people that receive adult social care support that we don't support as a council. So we support about 40% of the people in Nottinghamshire who receive care. The other 60% pay for their own care. So they're what we call self-funders. Under the Care Act, we still have a duty for self-funders in two ways. One is to give them good information, advice and guidance so they can prevent and reduce and delay their own social care. In other words, make the most of their own lives. But also if there's a safeguarding concern. So our safeguarding duties apply to anybody who has a legible social care need, whether they're paying for their care or not. That's sort of what is adult social care. I wonder, Chair, whether it's a good point to pause.
Yeah. Well, I have a question as well. Just on that point of the 23,250, is that figure set in law? Is that reviewed? Does that change with inflation? So
it's set in law. So this was part of the Care Act. There were other what are called funding reforms that provisions are made when the Care Act the government hasn't switched on. And you may have heard the government talk about delaying charging reform, and that's what that refers to, the fact that these reforms have been delayed. They haven't had inflation, and neither has the minimum income guarantee. So that's the amount of money I'm allowed to keep before I start paying for care. So you can see immediately that there's an issue for people when these rates were set 10 years ago and inflation has far outstripped that. So that's a real concern about affordability and paying for care. And it'd be one of the things that I would recommend to committee is having an eye on what's happening nationally with adult social care reform, with recommendations, particularly given there's the Casey Commission, which will be looking at some of these aspects. But yes, it's a real issue. And most people that we support, I would describe as being in deprivation and poverty. So you have to really be, quite poor to be receiving state-funded care. So that's a real issue.
Thank you.
I think it might be helpful that 23,000, whatever it is, pennies, includes the value of your house. So where people might be cash poor, they might be asset rich. And what happens is the state puts a charge on the house.
Yeah, that's correct.
And then when they sell the house, they get
pay it back.
You get paid through that.
Yeah.
And that's the important factor, because there are measures that they could put in place to stop that happening.
That's correct. We run what's called a deferred payment scheme as well. So where somebody, says, well, the payments for care you will get when I pass away and you sell the assets. So that's correct. We do have that as a scheme.
Okay.
So our duties, so we have a whole range of duties, so not least within the Care Act, but it's helpful, I think, on the slide there to summarise what we're doing. But effectively, we've got a duty to promote wellbeing. So it's not just about identifying need and then meeting those needs. We need to think about somebody's health and wellbeing in that context. So in other words, doing what we think is right for the wellbeing. And that's an important principle because in our constrained resources, we may be having a debate about whether we have enough resources to meet those needs, but the Care Act places a duty on us to focus on the person and their needs and their well-being, not, like I said, not released within this constrained environment. We need to promote diverse duties would be that first somebody has to be at risk of abuse and neglect, and that can sometimes be something that is quite subjective, but we do need to identify their experience in abuse. and then they need to make, like I said earlier, have an eligible social care need. But we also have a range of other duties across other legislation within the welfare arena. So the Health and Care Act was a really important piece of legislation of 3 years ago. This established integrated care systems, so much of the focus is on that as the main purpose of the Act. But alongside that, it also meant that CQC inspection of local authorities became instituted again. So local government used to be inspected by adult social care, that ceased about 10 years ago, and then that's now been reinstated. And so we're currently under that process now, being care quality assured. And we also have duties under the Mental Health Act. So our approved mental health practitioner service goes alongside a doctor to assess whether somebody will be detained under the Mental Health Act, and as part of reviewing those detentions under the Mental Health Act. That's a really important duty that sometimes gets overlooked. In the previous select committee, we had a really good session where we focused on mental health, because as a council, much of our work relies on the NHS who owns mental health. The NHS is the person that has the duty predominantly for mental health. So we're sort of quite driven by the quality of services in mental health. We have a really important AMP service. So one of the things maybe to consider in the work programme is looking at is how we undertake in those duties. We also have duty commission to services, professionals or carers or family to make decisions on their behalf. It's making sure that those rights and responsibilities are really well balanced and the person's at the centre of their care. And linked to that is a deprivation of liberty safeguards. So this is where somebody is restricted in their liberty. So I may be, 21, have a significant learning disability. I'm on in a unit that's got a locked door. I don't know how to get out of the door. That would be depriving me of my liberty. So these safeguards make sure that at any times when somebody's putting these things into place, that there's a proper process to make sure it's lawful and that person's rights are enabled. Another example may be that due to my disability, I'm not able to get out of bed, but then the staff aren't supporting me to get out of bed and to interact with people and to leave. That would also be a restriction on liberty. So these are the sorts of things that we do under those safeguards. So I touched on safeguarding adults. We have a duty to protect adults from abuse or neglect and promote their well-being. So how do we do this in practice? Well, if we have reason to suspect that somebody's at risk, and the reasons we get are normally from other people. So it will be where maybe a member has heard from somebody in their patch that and they're worried about a neighbour, that they think that the elderly relative is having money stolen from a younger relative. So that may be an example. Or it may be a care home where there's concern that the quality of care in that home, that the intelligence that somebody's had, maybe a nurse, is that the care quality isn't very good. Or it may be that I'm somebody with a disability and there's a view from my family that the partner that I've got a relationship with is inappropriate for me and is a risk to me. So they're the sorts of things that we may get informed about. So our duty is to have a look at it, to examine it. We do that in partnership. So we'll do that by working with the person, working with the family, working with the professionals, work out whether there's any evidence about this. We'll take steps to try and safeguard them, and we'll do that through negotiation and conversation whether possible. If that doesn't meet the reduce the risk, we'll then undertake what's called a Section 42 investigation. But with our principles about least restriction and only acting when we have to, we'll try and minimise the work that we do to do that, because what's always important is putting the person at the centre of that. It's really crucial that we try to make safeguarding personal, which looks at how the person wants to reduce their risk, the decisions they want to take. Not everybody's able to describe their feelings and wishes. They may not have the communication to do that. They may not, their disability or illness might prevent that. So what we then do is take steps through advocacy to try and hear that voice of the person. I'm just going to pause there just for a moment, Chair, if that's okay.
That's fine, yeah.
All right, to carry on.
Just a couple, if I may. So when you say about the councillors hearing about it, I think it's a bit of a training session anyway. So one of the things that's come up in my patch, I think it'd be helpful for members to understand that goes on, is cuckooing. So I don't know if you know what cuckooing is. It's basically where somebody from the community will go into somebody's house, dominate that house, and then do drugs and things like that from that house. Yeah, and it's called cookering.
That's a term I'm not familiar with.
Yeah, well, I've had it happen to a couple of houses in my estate, so it does happen. And it's about, once you're aware of it, you've got to go down the social services and police route, because obviously they're both combined. So I think that's important to understand. That sort of thing does go on.
Yeah.
And it's not always dead obvious at first, but often the property gets reported as a drug house, and then they look at the person living there as a decent person, they maybe have learning difficulties,
Taken advantage
or
of.
something like that, and being taken advantage of, and investigations then go on to sort of catch the people that done it. But there's ways of, if you suspect that they're happening, of preventing it, and they put CCTV around the house and in the house and make it more secure so you can stop people going in. There's lots of things that can go on. And I think also be helpful, because if we just explain a little bit about where you say it's our responsibility to make sure the safeguarding of the people, and the right people are making the decisions about that particular person, we then have lasting powers of attorney, and they can impact on what you can and cannot do. And I think it'd be helpful for members to understand a little bit about that as well, because it's not always black and white, is it, as we know, how you can deal with things. I just think it'd be helpful. Yeah.
Just on that first point, so the last point first, Councillor Gulling, yes, there are a range of measures that the courts or others can put into place so somebody else can speak on their behalf. So lasting power of attorney is a very classic one, particularly for older adults. Another would be where the Court of Protection has made an order in somebody's interest. Yeah, you're right, there's a whole range of things that we have to have regard to. On the second bit, actually I thought there was a slide about the partnership board, there isn't, so I just talked about. On the second bit about working with others, so we have a Safeguarding Adults Board in Nottinghamshire. The other two statutory partners for safeguarding are the NHS, so the Integrated Care Board, and the police. So we work in partnership on both an operational basis, so our multi-agency safeguarding hub, the MASH, has police and health and social work within it. And then we have a senior board called the Adult Safeguarding Board above it. So every year, the independent chair of that board, who we appoint as a council, comes to select committee. It's part of the requirement to talk about the work programme, and then we'll present on the actions of the previous year. So it's an opportunity for you to really challenge the chair and the board about the work they're doing to collaborate and coordinate, because you're right, Councillor Girling, those sorts of examples require working with the housing authority if somebody has housing, with the police. It's sort of a whole Nottinghamshire effort to put in arrangements in place, that not least because those examples are linked to serious crime in the main. So yeah, so we also have a safeguarding board.
Thank you. Councillor Erland, follow up at all?
No, I think it was just, I know that it happens.
Yeah.
I know there's a lot of new councils.
I've written that down.
And I think it's important. Well, you said you want us to be helpful.
Absolutely.
Being helpful and non-political.
And I just know as well, obviously, this will be included in the work programme anyway, because we bring it every year. But in the past few years, it has been a really important item. And a couple of years ago, the committee made some really good comments that led to some actual proactive action from the Safeguarding Board, where they went to propose some stuff up about some stuff that members had some concerns of. So it is a really important report.
Councillor Butler.
We mentioned training, which is part of today and as we go on, but not just for this committee. But I wonder, there are so many new members, both on this committee, but also across the authority as a whole, and indeed old members who may need brushing up on processes. Well, actually, Melanie mentioned that as a member, we may hear of a case. We may become aware of constituents or someone who's where it's from. We may hear it directly or third hand. Would it be useful to perhaps produce some sort of little guide or flow chart, call it what you will, just to advise members of who to contact and how to, etc., become aware of cases? Because I have to admit, I sometimes struggle to think about, well, where do I go? Who do I go to? So I'm just wondering whether that might be something to come out of the committee.
So really happy to do that. So in adult social care, we have our members' inquiry line. So that will be dealt with urgently. So any member who has a concern can do that. It's also quite common for those of you that know me or know our cabinet member to make personal contact and you can reach us by then. So that's another method of contact. But we also have a safeguarding line. So we can send round, certainly Martin can't, with the links, the Adult Safeguarding Board, because we publish how to do that about if you've got a serious concern that needs to be dealt with instantly if somebody's at risk. Yeah, so we can summarise all of those in a moment.
Yeah, no, that'd be brilliant. Yeah, that could be circulated to all members. That'd be great. Thank you. Councillor Wright?
Hi. Do we do spot checks on care homes? How does that work? Or do we just rely on whistleblowers?
Yeah, we do some work about auditing the care market. So there's 35,000 people that work in social care out there and 450 providers. Not all of them we have a relationship with. So for those we don't have a relationship with, there's no duty at all on the council to check the quality of that care. That sits with the Care Quality Commission who regulate care. So the main duty for regulating social care sits with the Care Quality Commission. So it's not the role of the council. However, when we're placing somebody in a service, whether that's a day service, home care, a care home, we have a responsibility to make sure that person's safe through reviewing process and through contracts, because it's a it's a commercial relationship. So yes, we will then have a process of checking and auditing, but we do that in partnership with others. So we work in partnership with the NHS for nursing care, for example. So we have a team that Katie hosts, that's a joint team managing that work, and we do it on a risk basis, not the case.
Yeah.
We don't check everybody.
Yeah. And just to give an example, in the last 10 months, we have audited all over 65 care homes, and we're on a cycle where we'll have all under 65 care homes audited by December.
Where we commission.
That we commission. Yeah.
Do you just come out the blue unannounced to those, or do they know that you're coming?
A little bit of both. We've got a really good relationship with our market generally, with our providers, and we work really closely with our Nottinghamshire Care Association. So we have 30, 40 engagement events throughout the year talking about themes that we're looking at together, things that we're commissioning. We also have a risk matrix, so we track things like where care home managers are changing, because we know that that can be a time where things can change in a care home. So we have lots and lots of intelligence that comes in, and we have our own dashboards. So we'll make contact quite regularly with a range of homes. At any one time, there are normally a set of homes that we're working more intensively with, where there have been some concerns, and that might have come from staff, from families, or from our own audits. And we have different kind of rating levels in terms of risk. We've also got our social care teams that are reviewing people regularly all the time as well. So we do get information coming in with those extra eyes and ears. So there might be some homes that we don't have as much contact with because we've got intelligence that things are going okay. So they would then just be part of our general auditing. But where we've got intelligence, where we're more concerned, we'll work closely with them.
And as you'll see, Chair, later on, so we're coming on to this later, is we do bring a regular report on the state of the care quality in Nottinghamshire. So that describes intelligence, the ratings from the CQC, and then the sorts of activity we're undertaking when we have care homes in crisis.
Okay.
That's a regular report.
Right, thank you. Councillor Gowland.
Thank you. So following up from that, I think I may have misunderstood. I think you said 60% is self-funded, but I think you also said so that although you don't say take responsibility for the care, you might be providing lists of homes and things like that that they could be going to. And also in a previous meeting, you discussed the issue where maybe the market's failing in an area and the prices are going too high, and again you might intervene there because obviously that ultimately impacts on you. So do you have any oversight? Do you do any checking on those homes that you may be giving lists of to residents who are self-funding?
We don't give lists of any care homes. When we give an information to somebody, it's their choice. So we direct them to where there's information such as the care quality.
Okay, so you wouldn't actually.
If we're supporting somebody directly as part of the social work and part of then the brokerage team that sits with Katie, there's a process to find the right level of support for somebody. So that would be assisted, and that would definitely then be fed by our intelligence. You know, we don't support self-funders out there to choose a home.
Okay.
All right, thank you. Yeah.
The local account, this is a really important document. I know I'm repeating a little bit from the induction. Some of you have heard me talk about this document a lot. The first thing to say is that this document was co-produced. So it was driven with people with lived experience and carers. It was presented to Cabinet by people with lived experience and a carer and me. So I was really proud of Nottinghamshire for taking such a bold step, because normally Cabinet's quite a closed endeavour. And then when we've looked at this in select committee to see how well we're doing, we've also had people with lived experience there. So I hope that's some of the ways of working that we continue. Our voice, as I said, is a group of people with lived experience, and we have a Making It Real forum, which is where we come together. So staff, managers, leaders, and people with lived experience to have a look at how well we're doing against the local account. So that's what the local account sort of is and how we work it. What it does is bring together lots of different sources of information. So it pulls together the things that government tell us to do. So the Department of Health and Social Care is a sponsored department for adult social care. We get funding, not much of it, but through the VAT department, which tells us the standards. They sponsor the Care Act. There's things that we have to do for government, and then you'll see that in our performance report. We call them Adult Social Care Outcome Framework. There's indicators that government tell us to meet. Then we have the views of people with lived experience and carers. So we have a biannual, sorry, I said that the wrong way around. What's it every other year? Well, anyway, every other year.
Biannual.
It is biannual, isn't it? Every other year we talk to people through the big conversation, and we hear about what's working for them, what isn't working for them, where do we need to improve. We pull that information in. We then have learning from complaints, from incidents, is kind of the intelligence bit, like the whistleblowing that Councillor Wright mentioned, so things that we hear about adult social care, how well we're doing. And then we have the priorities of the administration and the council plan. So bring together all of those priorities, put it into one place, and that's our local account. It's our adult social care strategy. So it tries to be a very honest account to people who pay for their own care about the things that we're doing well and the things that we're not doing so well. So like I say, we publish it every year through Cabinet. So it'll be due to be published in spring next year. So it will feature on your work programme for next year, and then there will be an annual report. So I do believe that we looked at this just before the end of the political year, didn't we, Katie? Because we had February. Yeah, so we kind of concluded the cycle, but that doesn't mean to say if you chose to, you could start to ask us about one of the indicators here or talk about it. And in the performance report that we bring to you every meeting, we will reference this as how well we're doing against the local account. I'm just going to talk you through some of the bits and pieces, then Katie and I will give a bit of an example. So Katie, I wonder if you want to just talk through wellbeing and independence.
Yep. So we do lots and lots of things to help people to stay as well as they can. So one example is people that have been into hospital, and we want to support them to go home as quickly as possible when they're medically fit to be discharged, and that where it might benefit people, we'll do some reablement, which is supporting confidence or physical, can lose confidence in that time, and tell us that when they have support through things like reablement, or we adaptation, and that might be technology enabled care, they feel much more confident, and so do their carers. Tech enabled care, certainly at the induction, I know lots of people did hear about this. We've worked really hard to have a tech first approach. So where we can give somebody some support through technology, rather than additional staffing, we're doing that. And we are almost at 50% of people with long-term support have got some sort of technology as part of their care, which has been really good. We track the impact of that. And people tell that we've got so many stories of difference of people telling us that they've been able to be more confident. They now really want to stay in their own homes. They feel much more confident to do that. Carers, so family carers, are feeling less anxious and less stressed because they've got things that are telling them that their loved one is going to the kitchen, going in the bathroom. There are alerts for medication and things like that. People are really well supported. We have a handy person service that goes and makes small adaptations in people's homes, and we have a big joint service with the City Council and the ICB that is about giving equipment to people, loaning it to them to help them to stay well at home as well. That might be walking aids, it might be special mattresses, for example. and we reach a lot of people through that service, and we recycle between 80 to 90% of that equipment, and are able to get that back out to other people when it comes back to us.
Can I ask a question, Emma? How do people access that service? Because when I dealt with something similar with my mother a few years back, finding any information out was nigh on impossible. So obviously these services exist, but if people don't know about them or how to access them, that's going to be very difficult for people to.
Well, we try to do some deep dives on where people are finding information and to see if our channels are working. So we have a lot of information on Notts Help Yourself. We have our front door, our customer service centre, that is normally the first place that families tend to start ringing, or people themselves. And so we do try to test, are we giving information to people at those points? We've got quite a big percentage of people that come to our front door do tend to then get some low prevention support. And that can often be some equipment, some early technology, etc. But that would be when you're eligible for adult social care. So that's when we start to put those things in place formally for people. But we have worked with our Making It Real Forum, who are the group of people with lived experience that hold us to account for our local account. We've done a deep dive on information and advice, which is a huge topic, but we did particularly look recently at when people are first starting to look for advice in their journey.
Well, and we know it's one of our areas for improvement. So in Bassetlaw, particularly, people said that they weren't able to access the customer services centre. So that's why we piloted in the libraries face-to-face contact. That's going really well. It's quite resource intensive, but that was going really well. And we also tried to target those points in somebody's life we know are high risk. So leaving hospital for an older person is often high risk, and by the time they reach us, there will have been health professionals who give information advice that may or may not be accurate, and sometimes isn't accurate. Or when somebody's looking at moving from children's services into adult services. So we also try to target those points in someone's life when people really need information. But it is an issue given we've got a population of 850 million and we only support 13,000 of them. And there's trying to get to those people that need us the most is an issue.
Yeah, I mean, it's interesting what you say, because Bassetlaw was 850,000. I knew what you meant.
It feels like it.
Nottinghamshire's grown. Yeah.
Bassetlaw was the area in question I was referring to. But I suppose really where I would follow up then, I mean, with that, again, if you in the system, what are the waiting times like for getting technology into the home? I would imagine that that's not necessarily a quick process, and also maybe we touch about on what types of technology assistance is available. Is that pretty quick?
Technology is pretty quick, but we do have waiting times for different bits of the service. So our biggest waiting time is for deprivation of liberty safeguard. So I mentioned that in the introduction.
Yes.
So that involves assessment from a best interest assessor, a doctor, and so it's quite a long process that can take quite a long time to conclude. We don't have any waiting times for safeguarding or urgent work or assessments that have been triaged, but we do have some people waiting too long for review. So about 28% of people are waiting too long for review, for example. But in the report that we bring on performance, we'll talk about all the different areas of our waiting times, because it's quite a big service. The waiting times vary, and it's dependent whether you're leaving a hospital to whether you're somebody in the community who needs more support. So it's quite a different experience.
Right, thank you. Who went? Councillor Dowland.
Sorry, it's the same question actually as before almost. So again, if somebody's got £30,000 reserved and they need digital technology, will you help them with that? Because I think they're very vulnerable to being ripped off if they are going to the market, I guess, at that point.
If we're supporting them, then yes, we would be given information about on technology, but not if they're self-funders. It's unlikely. We are looking at the moment to see about whether we've got an information offer for depleters. But I think it's fair to say, Councillor Gelman, that main people don't particularly want to have contact with the council. So some do contact us for support for self-funding. But in the main, it's not something that people generally, we're not the sort of place of support. But I'm not sure that technology, people are getting ripped off necessarily with technology, but I don't know, it's not.
You're a more optimistic person than me.
Well, I mean, I'm more honest, I don't know whether that's a concern. It's not a concern that self-funders have raised a lot, so it's genuine, I don't know. Yeah.
Councillor Gurley?
Yeah, although it's not tech support really, I think it might be handy that members know that, particularly for when they're coming out of hospital and things like that, if their circumstances have changed, there is a fund to adapt their property so that they can be at home as well, and that's managed by the districts and boroughs.
Okay.
Yeah, so I think it's important that members understand that fund is available as well, because it's not just about the tech. They might need handrails, they might need a wet room to have a shower or whatever. There's all sorts of things that can be done to their properties to adapt.
To adapt, yeah, keep them at home. Thank you.
And the last thing I want to mention on this slide is that, you know, adult social care and indeed the county council rely on other people to help us support, we support. So although when we're providing some direct service, like a day service, we'll work really hard to make sure that person leads a fulfilling life. We do rely on our partnerships with the voluntary sector, with Public Health Commission services, district and borough councils, with leisure centres. So there's a role that we have to enable people, but equally we need, you know, the world out there to be inclusive of older adults and disabled people and be working in partnership with us. So the active and supportive community bit is something we do in partnership with others.
Can I just add on that as well? Point, Chairman, if I may. Because it depends how you look at things, doesn't it? If you look at sort of the money that's spent on those voluntary sectors to do that sort of work, it's one of the most efficient ways of getting things done. If we did it ourselves, it'd be a lot more expensive. So it might be an area that people look at, oh, well, we're giving that charity this amount of money, let's cut it by 50%. Well, that 50% might save you so many £1,000s. It might cost you a lot more than that to provide that service. So it's just like a friendly warning. Don't just think, oh, I'll cut all that money, because it's as simple as that.
Okay, so moving on to some of those other areas when things need to change. So where people's needs are changing, I think we've talked through reablement. We have a maximising independence service, which is internally run. And we work with a whole range of people. I think I've given quite a lot of examples of that. We also look at, so when things are changing for people and needs are increasing, we still try to promote as much independence as possible. So examples of trying to stop so many people going to residential care before they really need to is really important, both for that person and also on a financial sustainability basis for those people, and to be efficient with our own public funding. So that's where we look at things like home care in people's homes. We might look at what we call supported accommodation or extra care, which somebody still has their own front door, but they might have different types of support going in and out as they need it, which then stops people escalating, and that's part of our prevent, reduce, delay responsibility. And I think you just had a report to Cabinet that was talking about supported accommodation, really, really important for us. And we've, just as an example, we've just had 14 people that have just moved into 2 new schemes, and lots of work was done with those people so that they have become, they've had friendships develop, they've become a community as well in terms of moving in, and that support is on site for those people. But also it's shown that we've saved quite a lot of money by doing that as well, and those people feel really excited about that new move, which is right for them. Flexible and integrated care. So we have our carers strategy between ourselves, the City Council and the ICB, and that was co-produced with carers. We've made a really, really good amount of progress with supporting the carers that we know about, and those carers that we're working with generally tell us that their support is good and their anxiety has gone down. But we have a huge amount of self-reported carers in Nottinghamshire, about 83,000, which not everybody needs support, but we know that there's an under-reporting of the amount of carers. We know that we've got some areas in this county that are in the highest in the country in terms of unpaid family carers, Mansfield and Ashfield particularly, and that we need to make sure that all employers across Nottinghamshire understand that they will have people in their workforce that are carers and that we need to be flexible and look after them, but also make sure there's lots of good advice out there. So we've got co-produced booklets for people. We have our carers hub. We have young carers support. We're looking at, we've given free tram and bus travel for young carers, for example. We've got some gym memberships and things and small budgets for people to have short breaks with. And we know that people are caring, we have a proportion that are caring for over 50 hours per week, for example. So really, really important that we're getting that support right. We have direct payments. So people, ultimately we want people to have as much choice and control over the support, their care and support as possible. So having a direct payment, so basically a personal budget, and we work with people to set that up. We benchmark really highly for the amount of people that actually have a direct payment in Nottinghamshire compared to other places, both working age and older adults, which is really positive. So examples of that is having a personal assistant. So it's finding somebody that is right for you, that fits with you or fits with your family, that can be really helpful in terms of the outcomes that you're working on. And that might be food preparation, it might be working towards volunteering or getting a job, or it might be very personal care that that person comes in to do. So we're doing very well on that. And at the moment, we're just working with Think Local Act Personal, TLAC nationally, and people that have a direct payment in Nottinghamshire to look at what else we can do to improve our direct payments for people, and certainly being really creative and again plugging into local voluntary community groups and things that are on offer in your area, being really important part of that. And in terms of our workforce, we work really hard to support our internal workforce and our external workforce. We have a brand new hub internally, and we're just developing one externally that's got lots of support on there for people and your career. We provide apprenticeships. We work really closely with the local universities because we want to keep our homegrown talent as people are doing social care degrees or other courses. And so we offer apprenticeships into social work, occupational therapy, etc. So we have some fantastic routes. And I know we've got a slide coming up on the external workforce, so I'll come to that in a little bit.
And it's one of the areas that Select Committee has been interested in the past, because clearly that good quality care relies on the skill of the workforce. We don't have the workforce either in the care market or internally, particularly for care workers, registered managers, social care nurses and social workers are a particular gap. So we're under establishment, both ourselves and our provider market. So having enough workforce is really important. So maybe one of the things to consider with the work programme is how you look at the workforce. So I just wanted to touch on our practice framework. Again, this was driven with people, by our own staff and people with lived experience, and this tries to describe how we want people to experience us. It's a bit like our contract with people, so this is what they can expect from us. So when we talk to you in our performance report about our quality units and how we audit our work, how we get feedback from people, we do so against this framework. This is how we judge that piece of work as to whether it was a good piece of work or not. Just a little bit on the people that we support. So it's about 50-50 between older adults and working age adults. So for older adults, clearly that's not everybody over the age of 65. That's people who require additional support to live a good life. So typically with an older adult, that will be about mobility, about caring for oneself, being able to get around, being able to ensure that they eat regularly. Not exclusively, that's typically what it's like. For working age adults, it will be a whole range of things. It could be substance misuse, it could be mental health. We provide support into prisons, so we provide social care into our local prisons. We provide support for people under detention, so people with low disability, autism or mental health who are currently detained in mental health hospitals. We work on supporting those people to get home and their safety. And then we have our biggest group of people we support are adults with a learning disability who need support to live a good life effectively. So that's just, and we touched on about our workforce there. And our budget. So I'm sure you're aware there's a budget gap. So as a council, but in adult social care particularly, each year the money we're spending goes up more than the money we have coming in. So what we have every year is a gap. So the cost of the people we're supporting in April costs us more than the money we've given as a council to meet those people's needs. So there's a gap. So you'll talk, you'll hear me talking in the budget report section where I report to you about our sustainability work. So we can't afford every year to continue supporting people in the same way we're doing. So that's generally driven by market costs. So adult social care is a low pay sector. So it's really driven by inflation and living wage settlements at government level increase every year more than our council budget has gone up. It's really subject to inflation. So where there are residential services, they're impacted by food, utilities, things that are inflation sensitive. And generally, people's needs are becoming more complicated and people are living longer. So for those factors, like I say, every year, we're spending more than the money we have for that year. So sustainability and budget are really important every year. So the public invests 550 million roughly in adult social care. The net budget requirement of that is about 313 million, probably on the next slide. So adult social care income is really important because of client contributions. So people pay for their own care, which is why there's a gap quite uniquely between our gross and net budget as a council. So this is how we organise ourselves. So we're divided into three service areas. So Emma Shand leads our social work services. So the social workers in the main are those looking at people's safety through safeguarding and assessment under the Care Act. Katie, who you've heard talk about today, leads all of our commissioning, brokerage and contract services. So Katie's main role is getting care at good quality at the lowest cost, but also providing things like workforce engagement and workforce practice and quality measures. And Ainsley runs our internal services. So we have 9 day services, 3 short break units, a reablement service and a shared life service. So Ainsley runs those services. So we talked about the workforce. Katie, are there any sort of key figures for this you want to pull out?
Yeah, I think what I'd want to say about our external workforce, on the whole, we've got a relatively stable and sufficient market of provision. We have had some quality issues in some of our care homes. But on the whole, if you need support, we've got that in Nottinghamshire, which is really good. You can see we've got about 23,000 filled posts in our external workforce. We have a turnover rate of about 29% and a vacancy rate of about 7.5%. And our workforce is predominantly female with an average age of 41.5, which is interesting to know. You will also see that we do rely on international recruitment as well, and we have a welcome pack, we have a dashboard to understand our internationally recruited workforce. So yeah, very big workforce. We work really closely with our Nottinghamshire Care Association to make sure that we're looking together on themes, training, what people need in that external workforce. And we have an external workforce plan, which is co-produced with the workforce and clear priorities within that.
Just to note, your workforce is a gender. Gender is an issue in our workforce, and predominantly it'll be women who also have sort of caring responsibilities above and below, as we described. So we'll be parenting and caring and for relatives themselves. So that wellbeing piece is sort of set within that context. Within the external workforce, you'll see that there are more people who work part-time. So working part-time is very common in the external workforce. So we need to take these things into account when we're planning.
But perhaps perhaps at some point it might be useful to perhaps, if you like, compare how we're doing compared to other authorities, especially in things like the turnover rates.
Yes, absolutely.
I think I would imagine we're fairly good, but it would be good just to
have that comparison. Yeah. Councillor Rich?
Yes, I was going to ask about the turnover rates and why it's so high. I mean, I just want to know if it's like a toxic environment or is it an issue? That's what I'm trying to work out, because
we've got some decent, as you mentioned, we've got some decent people out there who wants to actually make a good thing in our county. And I want to know, why is there a massive turnover? Is it the reason why?
Pay. So this is a minimum wage workforce. So if I'm working particularly part-time and the household's dependent on my income, and the local Tesco's puts up the rates, or the chip shop gives us a shift premium, I'm going to be better off working somewhere else. So we know, look, from the workforce surveys, pay is the biggest driver. But as Katie's got on the slide here as well, that we've also got a workforce who are really dedicated and have been there a long time. So you tend to find that people come into care and they're not suited. So that would be another factor. And then the third thing will be leaving into better paid care work. So either coming into the council to be a community care officer or going into the NHS. There tend to be the three reasons that people give for leaving care. The turnover rate, the sector will say it's about pay.
Can I go for a follow-up question? Have you ever thought about just scaling the pay to markets and retain those staff itself? Because I guarantee it's probably expensive trying to recruit more and more staff over a long period of time. So is there any chance maybe I know it's probably minimum wage, but is there any chance you could scale the market, keeping the market itself? So I might consider that.
So it is a market.
Yeah.
We're working in partnership with our market, but also those providers are trying to run businesses. And what we do see is actually staff moving to different providers as well. So that's another for providers to think about. But we also think about where we've got perhaps oversupply, where we've got not enough. And so we take all of those factors into account when we're thinking through that structure of our fee strategy, and we compare to what other places are paying as well. It is difficult because, as Mel's suggested, this is a low paid workforce, and there is other competition in terms of supermarkets, the service sector, restaurants, etc. That there's bigger competition. So we do see some people coming in and out where they might think they want to do a caring role and find out that it's not actually for them. And we do have a workforce that we keep on a longer basis. We try very hard to support that dedicated workforce. We've done things like going out and doing public health checks and things, trying to keep people well. So we do a lot. We try and celebrate the workforce. Celebrating and valuing what our providers do is really, really important, and they tell us that. We had our first celebration event last November, which was phenomenal, and we've got another one. We've got loads of nominations for those awards, and I think we know that nationally this care workforce don't feel valued enough, and it's really important locally that we build on that and do recognise them.
Just on pay, so for every 50p we increase our own workforce, that's 4.5 million a year. So you can see if the council wanted to invest in 50p or a pound pay increase, it would cost 9 million. Nationally, it's 900 million for every 50p increase. So that's the reason it's about fiscal challenges.
I know of care homes, or I've had reports of care homes at the start of this financial year that have increased their fees by upwards of 15%. Which is a massive increase, particularly for obviously for self-funders. What do you think their justification is for increasing the fees so high? And particularly I've heard that that's not just necessarily 1 year, it's been happening over multiple years.
In terms of residential care, we've given really clear messages for a lot of years that we have oversupply. It's the only area where we've got oversupply. And what that can mean, and we've seen happen, is that when you've got too much, you've got a range of care homes that are running at an under occupancy rate that is not financially sustainable. We've then seen that translate into some poor quality in some places and non-viability for some care homes. And I guess the opposite is some care homes putting their prices up. We have a framework, we have a fee strategy that we've had lots of consultation with our market, and we've looked at all of the factors to try and be as fair as we can with the money that we have. So I think that 15% will be in the self-funder areas, and that is difficult.
Thank you.
Okay, so just to, as I mentioned, we've got a range of partners that we work together on, and I think it's really important for district and borough council. So we know there's no care without housing, yet we don't directly, until we have local government organisation anyway, we don't direct the amount of housing that the councils will give for people with social care needs. And so we work in partnership wherever we can. Effectively, what I'm trying to say here, we can't control what our partners do clearly, but we do try to collaborate where possible. As I mentioned, we have an inspection framework for adult social care. So we're currently under phase 1 of our assessment, which is our information return. So that's live at the moment. And we should be having an on-site visit into the new year and then a report into the spring after that. The Care Quality Commission regulates care. So they're the people that will assess whether a service is any good, and they'll use that rating of inadequate, requires improvement, good or outstanding. A 4-word rating as well. So our key risks and issues, I think I've covered off all of these as we talked through. So Katie's talked about our care market, that generally it's a really good market, but we do have care quality concerns that we need to deal with. Our budget, I've talked about the rising cost of care outstripping the money that we have coming in, so we always have a shortfall. Our waiting times, we're really stretched in the pandemic, and it's taken us a long time to recover that. They are recovering, but not at the rate that we would really like to see for people. Mental health is an issue. We have a really challenged mental health system with a provider that has significant concerns in the NHS. So we see many more mental health act assessments and detentions in our neighbouring councils. And then safeguarding. And because of the cost of living crisis and people's general quality of life, that then means you tend to see an increase in safeguarding. We're certainly seeing that every year. So the sorts of things as a committee to watch out for as we're working. So Councillor Butt, you asked about how do we compare. So here's just some insights on that. So we know that we support too many working age adults in residential care. So that's where we're not very favourable in terms of comparisons. Older adults, we perform really strongly on that, supporting people in their own home. And working age adults, we support people in the community. So that's it's quite a strong statistic, but less than some of our statistical neighbours. Whereas older adults, we perform better than the average. We're really strong on giving choice and control through direct payments. We're really strong on our safeguarding work and our reablement services. And then I mentioned there before about the waiting times, and that's an area of improvement. And this is just really some of the, I think what brings adult social care to life. I've tried to do that through the presentation. So I think now, Martin, this is over to you, isn't it?
Yes.
Or, do you want me to share your slides or?
Yeah, it's so a couple, so we're on slide 21, aren't we? So obviously for screening, there's different ways of working. So there's regular reports that come and members will agree that the frequency of those and what they'd like to see as part of the work programming process. For some areas, when we have like the list of suggestions, there's some areas that will benefit from like more scrutiny than you can fully give it in a 40-minute item at committee. So for that, you would consider whether a task and finish review would be the best place for that. Alternative, there's some items that always come up during like the work programme suggestions where members just feel they just want more information. So in those circumstances, we have a separate list, and so that's kind of like information for members, and we'll either do like an online briefing for members, or we'll send a briefing paper around just for members' information, because it's something they want to know about. There's not really kind of like any kind of like scrutiny work that needs being involved in that area. And I think, as Mel stressed about the thing, it's important, well, all scrutiny. If we're going to look at it, we've got to be thinking, can scrutiny make an impact? So we've got to be looking at the areas of responsibility that are the councils, and obviously by that view that members can then make recommendations or that can then change things for the better and look at the things that we are actually responsible for, rather than looking at things that we've only got a very small responsibility for, or there's so many other factors that contribute to those kind of issues. And like I say, we do try and make it as real as possible. Like I say, we have the Charity Safeguarding Board, comes every year. We've had people from the Making It Real Forum come to talk to us in the past. Other kind of like people from outside bodies. We've had I forgot the name, some of those people that deal with like the mental health side come to talk to us. So it's really trying to make it a bit more real. And hopefully as part of the work programme, we've done this for other committees. Just to make it kind of like more real, there might be the possibility of some kind of like site visits, going out, actually seeing things like that, because it makes it a bit more real, because it can start getting a little bit academic at times. So if you actually go and see services actually happening in the real, it does really bring it to life. And I know when we've done that for other scrutiny committees, it really has moved the discussion forward really helpfully.
Would that be something that you would arrange?
Yeah, it all depends what comes out of the work programme discussions. We'll work with colleagues to work out if there's anything that it would fit for that kind of stuff.
All right, thank you.
Councillor
Gurley.
Yeah, thank you, Chairman. I think it would have been really helpful if we'd have had the previous work programme put in the papers for this meeting.
It's here.
But it should have been in the documents, so that we could have a look at it, and then because we're not got the next meeting till September, so we're not going to decide what we're going to be looking at until September. And then we tend to start to working on things. Yeah, if we'd have had it in the papers now, we could have had a discussion now, say, right, well, that one's really important, we could get on with that and get on with it straight away. So I think I'd have preferred to have had it so we'd all got it, and then we could have a look at it and come here to the meeting.
What we'll do after today, and what we've done for all the meetings, is that I'll circulate this presentation. I'll circulate the last work programme, which is available online. So I'll send you a copy of it and a link to it. Also, the terms of reference report. Kind of got ahead of myself slightly, but I'll kind of say it now. Then what I'll be doing, we'll be asking members based on looking at the old work programme, what you've heard today, and also your knowledge of your own kind of concerns, what kind of comes from like you work with in communities. We'll be asking members to let us know suggestions. You can let us know suggestions today, or if not, we'd like them all emailed to me by next Wednesday, so a week and a half. After that point, we'll be having a meeting with myself and Don, the chair, vice chair, and the chair and the vice chair. And the chair would like to invite a representative from the Conservative group and a representative from the Labour group to take part in that discussion at that meeting. We'll look at the long list of items, and then we'll kind of like score them on like the three kind of main screening criteria, which is ultimately, is it a focus of the council plan? Can scrutiny make a difference? And is it an issue that's impacting residents and is important to residents right across Nottinghamshire? Because if it's only impacting, if it's a very local concern, there's other ways of addressing it, maybe by looking direct to officers who can help with that type of inquiry.
Councillor Gallagher.
Can I come back?
Yeah.
Sorry. I totally disagree. Yeah, it's delaying it. We could have had it in the document. Yeah, it's all right. It's there. I could have looked at it, but I've only just been put on this committee. But we could have had a look at it and come here, and actually it could have been an agenda item here to say like what's relevant, because I don't know how important some of those things are and where we are with them. At what point are we supposed to be looking at it? It could have all been just done. Yeah, and I think that would have been really helpful rather than delaying, waiting for 3 people or 4 people to get together and talk about it. We're a committee, we could have just talked about it. And I'm not being, I'm trying to be, we're supposed to be like getting on. It's the biggest budget we've got in this council. And it's, we're not hitting the ground running.
My sincere apologies, because I'd asked for that pack to be, it's what what I'd agreed with the chair. So we'd agreed that as a pack of information to go out to you. So I'm really sorry that didn't happen. But I listed, including the last 2 sets of papers and these key strategies. So I'm really sorry about that, committee.
Fair enough.
But we will have there will be a full work programme, because we have to take the work programme to overview on the 4th of September for them to approve. And the next meeting of the committee will be full of substantive items that have been agreed as part of like the work programme process.
I made my point. I accept the apology, and I just thought if we could get the ground running.
All right, noted. That will be made available and we can discuss it. And perhaps yourself, Councillor Girling, will be when we meet as a subcommittee, to discuss the work programme, perhaps yourself?
Well, to be the spokesman.
Okay, no problem. But your comments are noted.
Yeah, thank you very much. Thanks, Chairman.
All right. Sorry, Councillor Gowland. Sorry, I do apologise.
So I haven't been on this committee before, but I'm looking back at the minutes in the last meeting, and there was an item 7 and item 8. It looked like they're rolling items. Adult social care performance, risk and financial position, quarter 3, 24, 25. So is there meant to be an hour quarter 4, and should it have been at this meeting or next meeting? You know, where are we on that cycle?
So each committee will bring the last performance report, but yes, there hasn't been a committee for some time, so there hasn't been one. But yes, it's on there as the potential areas of focus. So I can't bring it unless a committee agree to bring it, which is why it's not on the forward plan, because you know that's just the way officers work. So if that's what committee agree to pull, which I hope you do, because that's what I recommend, then yes, there will be. So we could easily bring, because we report regularly to the cabinet member, we can bring in the last year's performance, and then where we're up to in this year will be very straightforward for us to do.
Can we do that for the next
Yeah.
meeting? Do we all agree that that's vital?
And in the packet of information that we'd agreed with the chair, so apologies for me and the chair, because we had asked for it to be sent, we'd also said we'd like to put the performance report in so we can do that. We can get that attached from last year.
Thank you. Martin, anything else?
That's it. So that's for the items. Obviously, that's for consideration. So if you just want to go on to the next slide. Oh, the previous. Oh, I think we missed one out. I'll say it. It's fine.
I think there's one missing.
I think there's one missing. But ultimately, for scrutiny to be as effective as possible, we need to be looking at the areas of work where it can make its most impact, which I've already said. But what I really want to get over on the slide, that seems to be missing from this one, is that due to the amount of time and resources that are available, it's important that we're looking at things that A, where we can make an impact, but also B, that we've not kind of like looked at before most recently. So when you see the work programme that goes around, you'll see the stuff that's been looked at over the previous year. And if members don't have any concerns of how those kind of like services are operating, or if they don't need improvement, that's perhaps areas that we don't perhaps look at over the next year, because time is limited. We only have 4 meetings a year. To be effective, you probably only want to do 3 items per meeting, and that's a maximum. Reviews you can do it is probably 2 a year, so that you're probably looking at ultimately 14 items over the year. So it's just to really kind of like focus your activity, so we're not looking at the same things we've looked at in previous years.
Anything else?
No, that's it.
All right, lovely.
Members have got suggestions now, but if not, we'll just take them.
Yeah. Okay, so we'll throw it open to the floor, really. If anybody has any suggestions for items that we should include on the work programme, obviously, as Martin has said, they can be emailed in between now and next Wednesday, or if you want to share them now, then feel free. Councillor Jackson.
Yes, thank you, Chair. Firstly, if Martin could send members copies of the slides.
Yeah, I'll send the old work programme and the presentation.
And I just wondered if the portfolio that would like to update us what's gone across his desk over the last 3-4 months with adult social care, because there may be something there that we need to be looking into.
Well, all the stuff that you've just been going through, I can assure you I've gone through. And looking forward at the budget, we've had a meeting this morning talking about the first quarter and looking at that. I'm a bit disappointed that you've not seen this programme here before, because I would have thought you could have had an agenda now, items ready to start to discuss, and I could have probably helped you with I'd like you to look at as well. So I do think that a lot of things can be done to support me and director in this adult social care. It's a lot of work, a lot of things to be happening, and obviously the staff are very busy at the moment with the CQC appointed coming in to look at our services. So they are very, very busy people at the moment. But I think at the end of the day, you need to be supporting, as far as I'm concerned, me, and looking into it and offering support and help with the issues that's on there. And the budget is obviously a main one, because as you all know, There was an overspend last year of 20 million. So we're looking to address that in whatever way we can. It's very difficult in adult social care because we don't know what's going to be next through the door. Obviously, because it's not like a day-to-day business that can run a normal service in and you can judge it and test it and you know what's going to happen. We don't know in this department. So there's a lot to be looked at on that sense. And I know that the staff are looking at various aspects of making savings. Technology is one of them that is happening. And I think that we're doing a lot with technology to support people and to keep people in their own way possible. Because we all know, and you all know that the biggest cost that we have is putting people into nursing homes. And when we can avoid to do that, then we need to. But what people don't realise, a lot of people don't realise that most social service activities for people who have got any money or any assets, it's cost they're paying for it. So you might have saved all your life and save quite a lot of money and you might have a cash rich, but you could be property rich. But that eventually it's going to be used to support your care if it's needed to. So of course, everybody don't need that care, but a lot of people do. And particularly people who've got no money, because obviously then that costs us everything, because we have to pay for everything then. With people who haven't got any money, that's at the bottom end of the scale. So that's particularly in my area in Ashfield and Bassetlaw, those areas are the worst, most vulnerable areas and cost us the most money. But we have to address that. We don't have a choice on that. We have to deal with that. But of course, we don't know what's coming through the door. But the staff I know are working very hard to keep budgets as sane as possible. And knowing full well what we've gone through this last year, I'm certainly keeping a finger on the button and trying to support and help and question. Because my job is to make sure that the service runs as efficiently, as good as it possibly can. I'm not doing the decisions, these leads are doing it, but I am at least questioning them and everything that we're doing. Because I think there's a lot to be saved if we can do it right. And as I said, technology is a big saver. If you can put technology into people's homes to assess them, where we used to put them into a flat to assess them, that's saving that apartment, and it's also keeping them in their own environment, which is important to keep them at home where possible. So they're the things that we're looking at. So budget is a big one, a big issue, and keeping that, reducing that 20 million, in fact, eliminating it if possible, is the first target. Any savings we make beyond that is a plus.
Thank you, Councillor.
Probably budget is probably the thing we'll put top of the list again. And AI as well, and new technology. We have done work on that in the past, but it is, there's a saving to be made there if used properly.
Yeah, sure, note those. Councillor.
It's a comment member really. So budget aside, we all understand, I think, the financial pressures that brings. Having gone through what you've gone through as a cabinet member, what's the next biggest thing that is a worry to you?
CQC. Because
report.
Well, I'm not worried about what the outcomes necessarily will be, because we've got no destination. I mean, we've got no control over their outcomes, how they can investigate. I am told how good our service is, and I believe our service is generally in a good position. And I think that outcome a lot will happen after that outcome comes up. There may be some things that we have to take on board, issues that I'll have to bring in you to look at, because if there's a problem, then we need as much help and support as we can. Apart from the staff, we need your support as well. So that is the first issue, without a question, is to get through the CQC with a good team and set it moving right. But something, without a question, will come out of that inspection that needs to be looked at. There's little doubt about that. We're not going to come out with tick, 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 tick. I mean, it would be nice, but I don't see that. There's bound to be something in there that they pick up, and if they pick something up, then you need to look at it, and we need to look at it.
Thank you. Any further follow?
No, that's it. Thank you.
Any further questions from anybody else? Okay.
So if you just have your suggestions by next Wednesday, then I'll be mailing out with all the arrangements and all the information. So I'll be in touch later today.
Okay, thank you. Oh, Councillor McCormack. Sorry?
Chance of a quick comfort break.
I think we're about to wrap up. Yeah.
We're done.
Yeah, I think we're about finished now, yeah. All right, if there's no further questions from anybody, next committee meeting is September the 11th. So I wish you all a good August. I want to thank all the members for their contributions. Melanie, Katie, Martin as well for your time today and your presentation. Very informative. Thank you for your answers, Councillor Anson as well. Next meeting is September the 11th. So thank you very much for your time. Enjoy the rest of your day, and the meeting is now closed.